Hello, Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Today we are here at Maroof International Hospital and we are going to talk to Dr. Tehmina Rehman, who is a consultant gynecologist and obstetrician. Let's have a chat with her about what these two specialties are, what is the difference, and why women need to look after their health. Let's go and have a chat. As I said before, it's lovely to be here, and we are now going to talk to Dr. Tehmina Rehman. Dr. Tehmina, thank you so much for giving us the time today. It's lovely to see you.
Lovely to see you too.
And, I didn't go into her designation because it's a bit of a tongue twister for me. So let me try. Consultant, gynecologist, and obstetrician. I got it right.
Well done, bravo, bravo, you did that. Got it.
Okay, that's great. Okay, Tehmina, tell me, one thing that, people tend to get confused about, obstetrics and gynecology, are they two different things? And is it all about just having babies?
No, it's not. Certainly not all about having babies. Obstetrics is to do with babies, the birth of babies, the management of mom-to-bees, and the management of mommies who've just had a baby. So all that covers obstetrics. And a patient having any problems while she's pregnant.
Okay.
That's all obstetrics. While gynecology covers everything else, that the specific women systems, the gynecological parts that can go wrong with them. We have a multidisciplinary approach. When we do laparoscopies, we do with other laparoscopic surgeons, we do fertility treatments, we talk to each other, we work together as a team. So yes, let's go.
So thank you, Tehmina, for sitting down with us and giving us such important, I would say, essential information for every woman. The one you said about, that really went to my heart is that seeing a gynecologist every year. Imagine if people did that, how much they would pick up on. That is absolutely fantastic. And thank you for taking out the time and sitting down with us. And now we're going to go head off, see the hospital. This is Maroof International Hospital. And we can have a look at the labour room.
Yes.
Let's see what else we can discover.
Let's go.
Let's go.
So this is our labour room unit.
Okay.
We've got 4 labour rooms at present. We are making 2 more with bathtubs.
Okay.
For increased comfort, so that patients can spend a large part of their labour soaking and being relieved and relaxed.
I haven't heard a lot about that happening in Pakistan.
We're going to make them here on this side of the passage. We're going to
so once a woman is sort of like she's expected to deliver or she started her pains, this is the first place she'll come?
Yes, in an emergency, she comes here, the duty doctors assess her and then inform the consultant whose patient she is.
Right.
And the rest of the management is done by the doctor on the floor in consultation with the doctor.
The doctor that they're seeing. Okay.
So this is one of the labour rooms.
Right. Let's have a look here. So you were mentioning the different types of pain relief. We all know about epidurals, but you were mentioning gas as well.
You know about epidurals, but again, people have this misconception that it leads to back pain. It doesn't. Back pain happens in women who have not had epidural because that's part of the process of the hormonal changes and bad postures. Epidural is very safe. We've been giving it for more than 50 years. This is our daycare unit.
Okay.
When we are not planning to keep patients overnight, so we keep them here, and so as you can see, the nurses can keep an eye on people inside. It's for all specialities.
Okay.
But it's very convenient. And so let me show you one of them.
Right, let's have a look. So Tehmina, this is the daycare center that you were telling us about.
Yes.
And this is basically for people who've had a procedure, a surgical procedure, but they're not staying the night.
Absolutely. They're otherwise not infectious or anything. People who are minor procedures, they come in the morning, get admitted, leave by evening, and they're well monitored and well looked after, just as this gentleman who's about to go.
So Tehmina, now we are in the ICU, the place with all those machines and beeping noises and everything. Everyone here has a really, really responsible job. I mean, it's so important for them to be alert. Please tell us about the team here as well.
Mashallah, we have a very competent team, and they are round the clock. They have all the most serious patients here,
Yeah.
and they're all trained specially for this, and they are really top of the line. Alhamdulillah, very good recovery, and we obviously get the most seriously ill patients here. As I said, it's a tertiary referral center.
Right. And those screens, those are the monitors of the patients right now that you have?
Yes.
So you can see outside? Okay. Okay, right.
So they have central monitoring,
Right.
and each unit has every single facility.
Tehmina, thank you so much. You have taken out so much time for us today and have spoken so well on a subject that I think is so important for so many women out there to understand that their health should be a #1 priority. So Dr. Tehmina Rehman, who has been with us today, thank you so much for being here with us today and giving us so much valuable information.
Thank you so much, Shabnam. Always lovely chatting with you.
Same here. And any message you want to give to our viewers who are watching?
I think the message that I've already given, please come in for annual checkups, and once you're here, we'll tell you about all the things that we can do to improve your life and make sure you remain healthy. Thank you.